Hey folks, Nick the Nurse here. Today we're going to be talking about the nursing problem of Addison's disease. Addison's disease is an endocrine problem. You've got to know the nursing interventions. If you have a patient who has Addison's, if the patient comes up in a fact pattern on a nursing school exam or on the NCLEX. So let's review. First, you want to make sure that you treat any electrolyte imbalances. If they are hyper or hypo anything, correct it. Very big. Monitor vitals, intake and output. Encourage the patient to eat a diet high in sodium, protein, and carbs. Again, sodium, very big. Monitor blood glucose levels. Why? Because the patient who has Addison's can be hypoglycemic, low blood sugar, right? Instruct the patient to follow meticulous hand washing techniques and avoid others with infection due to immunosuppression from steroid drugs, because remember, the patient who has Addison's disease is going to have a lower steroid level than somebody who's normal or somebody who has Cushing's, where you have high steroid levels. So with Addison's, you want to make sure that you remember that. And remember that patients who are on steroids, right, steroids suppress the immune system. They also coincidentally lead to hyperglycemia, but we're not going to confuse you there. When you see Addison's, think hypoglycemia. Anyway, back to what we're talking about. No, I'm not going off on a tangent today. Educate the patient on how to avoid stress, as patients who have Addison's don't respond well to stress. These folks just don't respond well to stress, physiologically that is. Administer IV fluids as ordered to correct any fluid deficit. Administer steroids as ordered. Provide patient education on the triggers of Addisonian crisis, which include stress, surgery, sepsis, trauma, adrenal hemorrhage, or steroid withdrawal. So all of these things can lead to Addisonian crisis. Steroid withdrawal is a big one. I've seen that tested when I was a nursing student in nursing school. Make sure that you are familiar with that. Signs and symptoms of Addisonian crisis include severe headache and back pain, fever, joint pain, tachycardia, weakness, tachypnea, chills, excessive sweating on face and palms of the hands. That's really big. A patient who has Addisonian crisis will have excessive sweating on the face and the palms of the hands, as well as hypotension, confusion, renal failure, and shock. Remember those. Also, nursing interventions for Addisonian crisis include providing the patient with glucocorticoids, monitoring mental status, as well as recording their vitals. So a lot to take in there. Make sure that you review the nursing interventions associated with treating a patient on nursing school exams or on the NCLEX that deal with Addison's disease. Know them, you'll be golden. Again, my name is Nick the Nurse. I want to thank you for watching this video today. Check out my other completely free, no obligation videos at www.nickthenurse.com. Again, that's www.nickthenurse.com. Thanks for watching, and I'll see you next time.